Dear learners, welcome back to NPTEL online certification course on novel drug delivery system. I am Dr. Satish Devanapelli, Assistant Professor at Department of Pharmaceutical Science and Technology, Institute of Chemical Technology, Mumbai. So, in our previous lectures, we started with the controlled drug delivery systems. In that, we have discussed various important aspects on control release drug delivery systems, and in that we have discussed various approaches to design control release drug delivery systems. In our previous lectures, we have discussed what are the general considerations for control release drug delivery system, and then we have seen some of the key aspects which are important to design control release drug delivery systems. And then we started on the designing of various controlled drug delivery systems. In that, in our previous lecture, we have discussed various types of the control release drug delivery systems. In that, we have seen, so what are the dissolution control release drug delivery systems, and then further we have discussed on the diffusion control drug delivery systems, and later we have seen the combinations of both dissolution and the diffusion control drug delivery systems. And today we are going to see few of the designing approaches in the control release drug delivery systems. So, today I am going to discuss on the two topics, that is ion exchange resin as a controlled drug delivery system, and then I will discuss on osmotically controlled drug delivery systems. So, coming to the topic ion exchange resin as a controlled drug delivery systems, and we know that these are the polymers which are water insoluble and the synthetic polymers, and these are the properties are very important during the selections of the resins. This polymer should be water insoluble and that should contain either acidic or basic functional groups that should be repeated in a pattern. So, that is a property of the polymer. So, when you use such acidic and basic functionalities, so this will help to interact with the drugs which are ionic in nature. So, here you can see these are widely used to release the free drugs by forming the reversible, this is not irreversible, remember this point, this is a reversible weak ionic bonds with drugs based on the charge interactions. So, now your resin as well as your drug should have the ionic properties, so that these two we can interact it and we can make a complex and we give it as an ion exchange resin as a controlled drug delivery systems. So, after administration into the body or in the physiological medium, when you disperse, when you administer, the charged ions will replace the drug on the ion exchange resin in the body, then your drug will be released. So, which are preferably sodium, potassium and the chloride ions will replace the drug which are presented on the ion exchange resins. Now, with this pictorial representation, you will understand how we can make ion exchange resin complexations for control release drug delivery systems. So, here we can see, so this is the one type of resin which contain SO3Na sulfonic acid functionalities. Now, you have a drug which contain hydrochloride, and here we can make a complexation of these two components, that is resin and then your drug. So, by doing some of the interaction studies, by following these weak ionic bonds, and we can make a complex. So, this is we do by doing various trials and error studies. With that, we will understand the optimum ratio of the drug is required to complex with the proper resin. Once that is established and we do various evaluation studies, yes, the drug need to be complexed and further that need to be released from the carrier, that is nothing but ion exchange resin. So, here we do some of the in vitro studies and there your drug need to be released out from your material. So, yes, after complexation we will do various in vitro studies, also in vivo studies at that physiological medium. So, your drug need to be released. So, you can see this may happen in your the GIT and other biological systems and also which may happen in the physiological conditions, and then your drug will release. Now, here you can see again your drug is releasing, here sodium replaces the drug from the resin. Now, your drug is available at the absorption site. So, with this we can control the release, and not only that, we can mask the taste and we can also protect the drug from the degradations. So, this is the one of the major properties which we can use it as an ion exchange resins for the controlled drug delivery systems. Now, here we will see some other important factors here which will control the release rate of your drug. Yes, your release rate will depend on the various factors, that is including the pH at the target site. After administration, the pH is very important because that is a critical factor. There you will see the exchange of the ions from the physiological medium or at the environment that will come and replace the drug from the ion exchange resin. So, the pH condition is very important. When you take the cationic exchange resins as well as anionic exchange resins, so based on that we need to identify the optimum pH, and based on that we can target to particular the pH range of the GIT tract. And not only that, and the efficacy or efficiency of your resin will also depends on the ionic strength of the your release environment, that is also known as physiological medium. So, that is also very important. And then the molecular weight, charge density of both resin drugs also very important. This all we need to perform during the pre-formulation studies. So, based on the pre-formulation studies, if you understand the physicochemical properties of your drug, it is very easy to select the right resin. So, once you are done with this molecular weight and charge density, after understanding you can select right resin for the interaction. And yes, particle size of the resin and the cross linking density also will influence the release rate, because if you the particle size also one of the major factor that will also vary the release rate of the drug in the body. So, these factors need to be considered while selection of the ion exchange resins. And yes, these applications are very important. Yes, now we are discussing on controlled drug release, but not only that, these are the carrier systems or the polymeric systems which will enhance the bioavailability of the various drugs, because of the most of the pharmaceutical drugs undergo the degradation because of the enzymes and the acidic conditions. So, we can also protect the drug which are sensitive drugs by using the resins, and not only that, we can also improve the taste. That means, we can mask the taste of the bitter drugs, especially in case of oral dosage forms. We need to complex with the ion exchange resins, which will improve the palatability of the products. As we know that definitely, and this control is formulations also possible with the ion exchange resins as a carriers. Now, here we will see the two different types of the resins, that is, first is cation resins and then anion resins. So, here this can be abbreviated in CER, that is cation exchange resin, which composed of the anionic groups which are negatively charged groups. Now, here you can see in the picture representation, this is the resin which represents the cationic resins, and which contains the, in the peripheral, in their structure you will see the negative charge, which are anionic groups. Especially these are the two examples, carboxylic acid and the sulfonic acids are the two functional groups which need to be present in the cationic exchange resins, which will attract the cation drugs for the delivery. So, whenever you into administration, what happen? Your cationic drug will be replaced by with the ions, whereas anionic exchange resins which are suitable for the anionic drugs, because which contain the cationic groups which are nothing but positively charged. As we know that the quaternary ammonium and amine groups will show the positive charge that need to be present in your anionic exchange resin, so that you can use anionic drugs. So, with that we can make a bond between the cationic groups of resin as well as anionic drugs. So, that will makes the complexation. Now, here you can see the example anionic exchange resins. So, this is a resin here which contains the positive charge, that is the cationic groups. So, here we can complex with the various types of the anionic drugs, and if you like to know more on this, what are the commercial products and what are the various types of the ion exchange resins, and that can be you can see here in this reference. So, yes, these are the few of the examples which are commercially available ion exchange resins. So, here we are going to discuss on the only resins. Okay. So, here you can see the brand names, and this will definitely will help if you would like to work on the ion exchange resins. So, this data will very helpful for you, because you can see the various industries provide various types of the resins. So, here you can see the amberlite IR 120 which comes in different names. You can see the all are the from the amberlite, and this is from the duolite, and here also duolite, and this is Dovex. So, these are various companies, they will develop the ion exchange resins, and you can see if you know your drug properties, based on that if your drug is cationic and anionic, based on that you need to select right type of resins for the preparation of the ion exchange resins. So, yes, which contain the sulfonic acid, carboxylic acid, and you can see the amino groups also. So, here you can see the polymer matrix systems. What are that? Yes, which contain polystyrene and yes, methacrylic acid and polystyrene, most of them are with the polystyrene. And one more important point is that while selecting, we need to consider the ion exchange capacity of your resin. So, here you can see the definition of ion exchange capacity, that is represented in millimole per gram. So, we need to determine, yes, if you go and see the all the properties of these commercial available products. So, definitely they will provide all this information of the ion exchange capacity, so that you can evaluate by the number of moles of ions, either it may be sodium or chlorine, which are adsorbed by the 1 gram of the dry resin in the hydrogen form or in the hydroxide form respectively. So, that will give the value of ion exchange capacity. Now, here you can see there are the products which are with the high ion exchange capacity, but we need to take right material. Yes, we should not focus on only ion exchange capacity, and we need to focus on other factors which we already discussed, and also you need to think about the your drug properties. Based on that, we need to select the right material. Ion exchange capacity should be optimum, that need to be maintained during the formulation. Now, here is the one of the commercial available product. You can see, as we know that this syrup is used for the treatment of cough. So, the company is Sun Pharmaceuticals. They have developed the novel formulation for the cough management. As we know, in the market there are so many products are available which comes in the various dosage forms, and yes, the limitation is that which can work for 6 to 8 hours, and of course, the efficacy and safety of the cough syrups is therapeutically limited. But these products, as the claim suggests, that this product will work for the 12 hours, and yes, the brand name is cherry cough syrup, you can see in the picture also. So, this will contain dextromethorphan hydrobromide, that is a 30 mg, and chlorpheniramine maleate 4 mg. So, which is used in the Indian market. And not only that, the great advantage of this medicine is that it will work for the 12 hours, and it prepared by using the technology, that is polystyrex technology. Nothing but here this technology will help to develop the various drug delivery formulations by using the polymer resins, and this formulation will show the sustained release. And not only that, this complexation with the ion exchange resin, which will reduce the bitter taste of these drugs, which are very, very bitter. We know that to mask the taste as well as to control the release. So, ion exchange release resin systems are the one of the most commonly used drug delivery systems. So, the best example is cherry cough syrup. This is the oral liquid formulations. With this, you can reduce the frequency of administration, and it can improve the patient compliance. So, now we will see the another type of drug delivery system, that is osmotically controlled release. Yeah. So, before going to learn osmotic controlled release system, we need to understand what is the osmosis. So, here I have mentioned the definition, with that you will understand. So, osmosis refers to the process of movement of solvent from the lower concentration of solute towards the high concentration of solute across the semi-permeable membrane, whereas diffusion is the movement from high concentration to the lower concentration, whereas here the movement of solvent from the low concentration to the high concentration through the semi-permeable membrane. Now, you can see here these are the solutes which are represented in yellow color. Now, here the number of the solutes are very less. So, that is represented in the low concentration, whereas here the high concentration. Now, so it is separated by the semi-permeable membrane. Now, when you apply some pressure, what happens? The solutes moves from the low concentration to high concentration. So, that is called as osmosis. So, osmotic pressure is very important. So, that can be created by using various types of the materials. So, that is osmotic drug delivery uses the osmotic pressure for controlled delivery of the drugs by using the osmogens, which will induce the osmosis within the system. Now, these formulation we can give in the injectable formats as well as oral formats. So, here you will see the more detail on the components which are used in the osmotic drug delivery systems. As we know that it contains the semi-permeable membrane that should be having a property to permeate the water and but should not permeate the solute from the system. So, that should have any polymer which we are going to use as a semi-permeable that should be permeate the water, but it should not impermeate any type of solute from the system. So, while selecting of such cases, we need to look on these properties for the semi-permeable membrane. So, here these are the some examples: cellulose acetate, cellulose triacetate and ethyl cellulose are the commonly used semi-permeable polymers while developing the osmotic systems. Now, here you can see there are the picture representation. So, this is the osmotic delivery system. Here you can see the orifice. From this your drug will release to the physiological medium, and here is the drug reservoir. Here we will load the drug, and this is the elastic wall that will flexible, and here we add osmotic agent. These are the examples: the potassium chloride, sodium chloride, mannitol are the most commonly used osmogens which will induce the osmotic pressure in the system. So, after administration the water will enter into the osmogenic area and that will induce the pressure and your drug will release out into the required medium or in the biological site. And we can also see here with this another pictorial representation, here there are the two compartments. One compartment will filled with the osmotic agent and the another compartment that is drug dispersed in this material, and the outside you can see that is a semi permeable membrane. Now, water will enter into this, that will induce the pressure, and from this orifice your drug will release out. So, you can see the extension of this system, it is moved and then further your drug will is coming out. So, with this we can expect the osmotically controlled release systems. So, these are the some of the commercially products which are available as in a osmotic control systems. So, here three products you can see. First is the nifedipine and another one is the pseudoephedrine and leuprolide acetate, which all three are the osmotically controlled systems. So, these are the brand names Procardia XL and Sudafed and Viadur. So, with these formulations we can expect the release from 24 to 12 months. So, try to understand the importance of the control release formulations. As we know that these drugs are used for the various treatments and which are the chronic diseases, such case also we can use control release formulations, and for the respiratory treatment and other the applications. So, these are the formulations. With this we can maintain the osmotic control drug release formulations. So, the another topic that is swelling control drug delivery systems. So, here also we use polymers which are the hydrophilic in nature. Your drug need to be dispersed or dissolved in the hydrophilic matrix when your polymer in the glassy state, that is hard and rigid state. Such conditions we need to add our drug and dispersed or dissolved with the hydrophilic polymer. So, that need to be further processed as a finished product. When you administer or when you do some any physiological studies or in vitro release studies, such cases we take our carrier system or the dosage forms and will put in the biological mediums or in the in vitro dissolution medium. So, in such conditions what happen, your water will penetrate into the matrix. Now, here you can see this is the polymer, this is a polymeric system and here is the water molecules which are enter into the these systems. This is a drug dispersed in the polymeric matrix. Now, you can see once the water is entered or penetrated into this system, the size of the system you can see it is increased. That means the material is swollen, and at that stage your drug will release slowly from your system. So, this will happen because of the glass transition temperature happens for your polymer. So, then your matrix will swells and slowly the drug will release and come out from the polymeric system. Because of now you can see further at certain point your polymer swelling will stop, and that leads to the further controlled release of your formulation. So, here we need to focus on the swelling index of the hydrophilic polymers which are suitable as in a swelling control drug delivery systems. There are the reports suggest that. So, both osmotic pressure controlled and swelling control systems comes under the water penetration control drug delivery systems. In both cases, the last two systems, the osmotic and the swelling control, which are water will penetrate into the control drug delivery systems. So, these are the few types of control dosage form which are available in finished product. That means, these all types of the formulations we can convert into the oral formulation as a control delivery. Either we can use tablets and we can use capsules, we can also use syrups, as we have seen one example with the cherry cough formulation. Yes, you can also make transdermal control release formulations. We can also make implants which will also show the control studies for the various active molecules. We can make hydrogels, the polymer should be having a water holding capacity, and these systems also can be used as an ocular inserts. And this is not only the only these examples are limited for the converting of your formulations into finished dosage forms. We can also make the various types of the parental formulations which are nothing but long acting injectables. So, with that we can make various types of the finished products by using all these types of the control release mechanisms. So, with this we are going to stop today's lecture. So far we have discussed what are the control release drug delivery system, and we learned what is the need of the control release drug delivery system, and also we have discussed various approaches to design control delivery system. And in that we have discussed on the dissolution control system and diffusion control release drug delivery system. Then we have discussed the combinations of dissolution and diffusion. Then today we discussed on the osmotically control release drug delivery system, ion exchange control release drug delivery system, and we have discussed some of the types of control release drug delivery dosage forms. Thank you so much. In our upcoming class, we are going to discuss on various other novel drug delivery systems. Thank you so much.